So you're all incredibly welcome to our Green Ribbon campaign. This is our 9th event, and we are delighted to have so many of you with us to celebrate Green Ribbon this year. We want to end mental health stigma, and what that really means is we want to have open conversations about mental health. We want people to feel comfortable about having conversations about their own mental health and about supporting others talking about mental health and what they may need. It is about normalising the conversations that we have and about finding out how we support people and how we have that conversation. So what we're going to do today is we're going to have a conversation about how we do that. The focus of our campaign this year is exclusion. So if you've been following us for a little while, you will have had a chance to follow us on social media. So we're on Facebook, Twitter and Instagram. We also have a podcast that you will find out more information about some of the people that we've been speaking to this year. We've been particularly focusing on some of the marginalised groups. So we're looking at people who have a double stigma. And this is one of the focuses of our campaign this year. When we're talking about exclusion, we're talking about how people feel different, how people feel that they may be treated differently because of their mental health. And then when we're talking about marginalised communities, we're talking about the additional stigma or the additional negative treatment that they receive because of the community that they're from. So when I'm talking about marginalised communities and we're talking about people who have double stigmas, it could be somebody from the LGBTQIA community, it could be somebody with a disability, it could be somebody from the traveller community or the Black and ethnic minority. There are so many different groups of people who are minorities, and it's about us learning and understanding what are the differences there, how can we be more supportive, how can we have more open conversations, and importantly, to understand that we all have mental health. So it doesn't matter what community we come from, it doesn't matter where we are in society, we all have mental health. So it is so important that we have these conversations. So I'm now officially going to open the event and I'm going to welcome our speakers. So to give you a quick run through of who we have today, we have the Mayor of Fingal, Seána with us. We have Minister Joe O'Brien, the Minister of State for Community Development and Charities, the Department of Rural Community Development with us. We also have Murchadha, founder of Amputee Disability Foundation Ireland with us. And we have Louise O'Brien, Corporate Social Responsibility Manager at Boots. And finally, we have one of our wonderful ambassadors, Michael Verrecchia, with us today as Carrie Deway. So I am just delighted to introduce our very first speaker and hand over to the Mayor of Fingal, Seána Rodaigh. Thanks for joining us.
Míle mágad, friend Barbara, and I am absolutely delighted and honoured to be here as part of the launch of this really, really important campaign this morning. As Mayor of Fingal, at one of 4 of the Dublin local authorities, mental health is a key priority for me during my term as Mayor. And to be honest, it was probably the primary motivator in me becoming involved in politics in the first place. So this is a really, really important event for me. Every day I work towards bringing mental health to the decision-making table. And as you said, trying to normalise the conversation around mental health. So I'm really grateful for the opportunity to speak to you this morning. And I'm also delighted that Minister for State, Joe O'Brien, who only lives very, very closely to me, as one of my neighbours, will be joining us too. I'm a teacher as well, and I have witnessed a huge increase in mental health difficulties and struggles over the past 17 years in my classroom. So put simply, I am an advocate for mental health education, opening conversations, which is exactly what this campaign does, and trying to advocate for desperately needed funding of mental health services. So 9 years ago, when the Green Ribbon campaign began, the stigma around speaking about mental health was much more prevalent than it is today. And while we as a society still have a very long way to go in educating ourselves and being educated about mental health, I suppose conversations about mental health are now more important, I think, than ever, particularly considering what we have lived through with the global pandemic. And Barbara mentioned the word stigma, and when I hear that word, the first things I think of are fear and shame. And in ways we all carry some kind of stigma. It might be very visible, or it could be something that's inside us that nobody else knows about. But those feelings of fear and shame are often very connected to stigma, and both of them thrive in darkness. So what I understand the Green Ribbon campaign does is it gives us an opportunity to begin to gently shine a light. It could be for ourselves, it could be for other people around us, and educating ourselves about mental health and starting to talk and to listen. As I said, as a teacher, I witnessed firsthand the benefit of teaching children from an early age about normalizing mental health, that their mental health is as important as their physical health. And if you think, if we started learning that at 4 years of age, if we had any mental education the way we do with PE, it really, really would make a big difference. I mean, if you ask kids to list ways in which they can look after their physical health, they can ream off lots of different things, but oftentimes it can be difficult for us to do the same in relation to our mental health. So the Green Ribbon campaign gives us an opportunity to start conversations about also what works well for us to keep mentally healthy. So I know me personally, like my number one reason for exercising is my mental health. And I would say that openly. I know that when I don't do certain things in my daily life, that I will begin to struggle. And I think that has changed. I don't think I may have been as open as I maybe a few years ago as I am now. And I think that is something that this campaign is really, really fantastic for. If you think about it, it'd be unusual for us to go through life without experiencing some kind of mental health difficulties, just as it would be extremely unusual to go through our lives without becoming physically ill at some point. I know from research that you've done that just over a third of the population claim to have or have had personal experience of a mental health problem. And really sadly, over half, 53%, would conceal a mental health problem from a family member or friend. And again, we hear stigma, fear. So really the importance of learning about anxiety, depression, complex illnesses like bipolar and psychosis really can only serve to help people who experience these, and also those around them who are in caring roles around them, and the general public as well. For me as well, it's important that people who suffer with mental illnesses are not the illness. That is part of their story, but it is most certainly not all of it. The global pandemic since March 2020 has had a hugely negative effect on many people's mental health, not everyone, but many people's, and our world was turned upside down. Things that we took for granted were taken away. And for many, social isolation meant that we didn't have the opportunities to connect with others at the most fundamental levels, just be it banter at work or concerts, sporting events, school gates, just general interaction. And with the Green Ribbon campaign, the whole idea is that connection, the starting of conversations, be they small or big. So it continues to be a very challenging time for many of us, and I think it will be for a long, long time to come. I think we're still in the midst of it, and it'll take us a long time to recalibrate in any way, or what that new normal is going to look like for us. Since March, I have seen really what is important in my own community. I live in Skerries and Fingal, and that real sense and responsibility when the pandemic hit of reaching out and looking after the most vulnerable first. So when we were stripped of everything that we accepted about being what was normal, what was left really was what truly remains. Also, the glorification of being busy, I think, was exposed for many as being the illusion that it is. And speaking personally, I went back to basics, exploring my own locality, spending time at home. Again, that I'm going to implement as part of my own mental health routines, really focus on those. So the Green Ribbon campaign is an international symbol of mental health awareness, and I will be wearing this for the next long time, and letting people know that we're open to starting conversations about mental health. And the more people who wear it, the better, the more visible it is. And the word open is really key for me. So by wearing the ribbon, I'm acknowledging that my mental health is a priority for me, for my overall health. And that is the same, I think, for every human being. I also want to educate myself more about particular mental illnesses, especially by listening to people's lived experiences. And Barbara mentioned people who from marginalised communities in particular this year. So if we can be open to each other and listen without feeling that we have to solve everything, I think that's also a fear that if you ask someone how they are and they tell you that suddenly you feel that you have to fix things, but that's not the case. And we can really give a gift to someone by simply being with them and listening to them and accompanying them on whatever part of the journey they're in. I admire and hugely respect anyone who talks openly about their mental health, and be it very complex difficulties or everyday difficulties. And it allows people really, when you hear someone speak openly about difficulties that they may have had with their mental health, I think you see them taking off a mask and you see them for how they really are, and that allows people around them then to do the same. They're saying, this is me, I'm struggling right now, or this is what I need you to do to help support me right now. Children learn from the feet of their masters, so the more we do this as adults in our society, the ripple effect that is going to have for all the people who are coming after us. We're trying to break a cycle in Ireland of centuries of suppression, of silence that has done untold damage, and we are still hearing the traumatic consequences of those. So I would say to everyone listening, let's start using our voices, let's start using our ears, asking someone how they are and really listening to the answer is a good place to start. We've an awful habit in Ireland of using the word grand to describe how we're feeling, and really that just means meh, so learning the language of our emotions can start at any age, but particularly when kids are younger, as they're learning phonics in school, wouldn't be great if they could use the ABCs, they could learn the ABCs of mental health, and it can be done because I see it being done in different schools. So finally, Barbara said we're going to be really focusing on individuals from marginalised communities with mental illnesses this year, and how sometimes they can be excluded from wider society. Even if we look at the suicide rates amongst members of the travelling community, it is incredibly, incredibly stark. And with every single statistic is a family who are left absolutely heartbroken and traumatized. People from marginalised communities with mental illnesses, as Barbara said, often suffer double stigma, and that leads to discrimination, oftentimes resulting in a reluctance to seek help, and also maybe lack of understanding from others. And again, we come back to education, and importantly asking those who are suffering what they need. So finally, let us not fool ourselves. Our mental health services are in crisis, and I can tell you that for sure. I could tell you harrowing stories about children and constituents who need clinical support but are on waiting lists for 4 years. We need more crisis teams, more inpatient beds for young people. We need eating disorder services, early intervention services, and addiction services to be fully funded. The WHO recommends that the mental health budget is 14% in Ireland. We currently spend 5%. So today, if we can, with the Green Ribbon campaign, let's not only start conversations about mental health, which is vitally, vitally important, but advocate for better investment in mental health services. Many of our healthcare professionals, who are our greatest resource in the HSC, are simply at breaking point. I would like to thank the National Office of Suicide Prevention for their incredible ongoing work in the area of mental health and their ongoing support for Seek Change and the Green Ribbon campaign. Thanks to Barbara Brennan and the Seek Change team for hosting this morning. And the energy, I said I wished we could meet in person, but even the energy I can feel from them virtually is just incredible. So I wish you every success in all you do and your tireless work. And to everyone who's in attendance today, it's great to see people with such an interest in this topic, and the more we can spread the ripple effect, the better. So by being here today, I hope that we commit to creating change, and it will come from the bottom up, with every conversation, with how we prioritize our own mental health, with advocating for more resources for an incredibly broken mental health service, with asking marginalised communities what supports they need to pave a smoother path forward for us all. So I will finish there. Gurv Mila Mwagwib for the invite to come along. As you can probably sense, this is my passion. So it's great to actually be able to speak at such an important launch. So I'll pass you back over to Barbara. Thank you very much.
Thank you so much. It's just so wonderful to hear your passion, and I'm delighted for the people in your area that they have your support, because it is conversations like this that we have, that we need to be understanding how we do it differently. And some of the things that I heard that you talked about, so you talked about being mentally healthy. I think that was really important, and something that we all have, you know, because when we were talking about mental health and the idea that we all have it, it's about what we do to keep ourselves well and healthy. And that idea of personal experience as well, when we were talking about ambassadors. The thing is that we are all ambassadors of our own lives, and we all have mental health. So it also means we have the capacity to become mentally unwell, and doing things like being mentally healthy exercises, doing those things, it can make such a huge difference to us. Then you talked about the education and, you know, for carers and for the general public. And I think the more that we put out there, the more conversations that we have, the more we can learn. And certainly this particular year for me personally and for Seechange has been a massive learning curve, because we have learned so much about the different communities that we engage with, and like that, the different people that are stigmatized in different ways, and we are starting to learn and understand that we should be doing things different. Because it's one of the things that sometimes when we see people who are different than us, or people who are struggling, we kind of think that the onus is on them, that they should be the ones getting help, they should be the ones accessing service, they should be the ones showing us how to do it, when actually we should be going to them, or we should at least be going halfway. So I think that's, you know, that piece that you said about China Light, I thought that was beautiful, and really to help people to understand that we all have responsibility. And you also said as well about that being the illness. I'm just going to ask if anybody is not muted, if I could ask you to now please mute, because we have a little bit of feedback. And I'm just going to ask if you aren't currently muted, if you could please do so. Thank you so much. So yeah, you mentioned about the education, and then you talked about not being illness. I thought that was a really powerful thing, and it is something that we have heard over and over again from our ambassadors, that people become identified as their illness. It's one of the only illnesses that we say, I am depressed, I am schizophrenic, I am bipolar. We wouldn't say I am cancer, we wouldn't say I am heart attack, we wouldn't say I am flu, even to bring it down to, you know, a common cold, or even now we're talking about COVID, we would not say I am COVID. And yet when we talk about our mental illness, we identify as that feeling, we identify as that illness, and that in itself is very disempowering. But for people who don't understand what it's like to have an illness in this area, it's more stigmatizing, because we're identifying that person. So that was a really powerful saying, or really, you know, a really strong thought that I really caught. Sticking with that piece around connection and COVID, you know, you mentioned about how we've lost so much connection, and even like this, you know, we're all on videos. For many people, we're in our homes. You know, for some of us, we're in offices on our own. We're still working out how we do that. And like that, the whole idea of Green Ribbon is to get people to start reconnecting, to have conversations and to reach out. And one of the things that I am grateful for is the fact that COVID has helped people change their conversations, that people are a little bit more open and saying, you know what, I am struggling, or I am stressed, or you know, I'm going through a difficult time, or I found this uncomfortable, or I've had this experience. What did you do if you had an experience similar? We never had that space before, and I think that's really important that we acknowledge that. And then lastly, you talked about the language of our emotions. I thought that was really beautiful and really important, because for so many of us, we're so busy all of the time that we don't have the space to consider, you know, what it is our emotions are telling us, or how to feel, or even how to work with those things. So, you know, I think that was really a really interesting piece. And I also appreciate your acknowledgement of the services as well, because I know a lot of people who either struggle with their mental health difficulties, or people who support people who are struggling, can sometimes be very negative about the services that are there. So it's great to see that people are recognizing that we do need to do more, that we are in crisis. But for the services and the service providers that are there, I know that they are working so hard to help people and to be of support. And one of the things we're going to do today is hopefully highlight some of the places where people can go to get help and supports for different things in different areas. And again, anything that we're going to talk about, we will link at the end in our chat and also on our website as well. So thank you so much for joining us. And I know that you probably need to jump off as well. So I appreciate your time, and we will be sharing this recording afterwards. So thank you so much for contributing.
Thank you. I wish I could stay, sorry.
Not at all, it's no problem. It's no problem. I hope you have a good afternoon. So now it is my great pleasure to introduce Joe O'Brien, the Minister of State for Community Development and Charities of the Department of Rural and Community Development. You're so very welcome to join us.
Thanks. Thank you very much, Barbara, and thank you to Seána as well. I mean, and I can vouch for Seána in terms of the fact that even before she got involved in politics, she very much lived the message of sea change in terms of mental health and young people in Skerries, where we both live as well. So it was obvious that her input very much came from experience and from the heart as well. So, and I know she had a very, very long meeting last night as well in Fingal County Council, so fair play to her for delivering like that. So thank you and good morning, and thank you to Sea Change, I suppose, for the invitation to speak to you all this morning. The Green Ribbon, I suppose, has become synonymous with mental health awareness in Ireland, and so I'm personally delighted to help launch this year's campaign. And I think with every campaign and with every Green Ribbon worn publicly, there is an increased chance and increased opportunities to destigmatise mental illness and to start conversations. But I can't help but feeling that with this campaign, there is more of an opportunity than ever to really turn around how we think and how we talk about mental illness. And I say this because I think that at the moment, every one of us has a shared mentally and emotionally traumatic experience, and that's of living through the pandemic. And obviously that trauma is of a different scale and of a different nature for everyone, but it's my belief that one way or another, everyone has had a traumatic experience in the last 18 months simply by living through the pandemic. But I think this trauma has given us an opportunity to open up a little bit more about our mental health and in turn about mental illness. And I also think the timing of this year's campaign launch is in many ways very timely, with the Taoiseach's address and the launch of the Reframing the Challenge plan last night. I think many people are feeling a lot of emotions, some conflicting ones. I think there's a level of excitement, there's a level of relief, but I also think there's very significant levels of anxiety, and not just anxiety because the virus is still with us, but I think anxiety because society is about to take back off into that fast, crazy mode that sometimes seems overwhelming for many, but indeed is of and at a pace that isn't always conducive to good mental health and frank discussions about mental illness. And I really like that phrase that Seána used there, the glorification of being busy. It is that's a fact, and it's a fact that is problematic for mental health and discussions about mental illness. But the timing is good also, I think, because in my own experience, our mental health can take the biggest hit during times of extreme pressure or strain, but it often doesn't manifest until after that pressure or strain eases. And I think as a society, we are hopefully beginning to enter that phase now. So it's a particularly good time to encourage destigmatization of mental illness and conversations about mental illness. And as Barbara and Sean have outlined, the theme of this year's campaign is exclusion. It's a theme very close to my own heart, both professionally and personally. As Minister with responsibility for social inclusion and oversight of the roadmap for social inclusion nationally, I spend a very large part of my time as a Minister exploring ways, trying to implement ways that reduce and eliminate exclusion across society. And in terms of exclusion and bringing it back closer again to this week, I do also feel that the timing of the campaign is particularly good in terms of the return to school. And it is this week that many families will deal with that first day in school or the return to school. And for almost all families, there is some level of stress involved, but families from marginalised or excluded groups in particular face the additional stress of worrying about whether their child or their children will be accepted. Will they be treated the same as other children, or will they be excluded? And of course, for the children themselves, those fears will be magnified. What if nobody wants to be friends? What if I'm bullied for who I am? And for those already at risk of or suffering from mental illness, such as stress can significantly amplify the problem. But those from marginalised communities risk a potential double stigma if they identify themselves as also struggling with their mental health. So I would like to give a message of solidarity with young people in particular this week who are facing the sometimes daunting prospect of school and are worried about being included this week and being part of the group. And I'd encourage all of us to listen and to reach out to the young people that we know this week and to see how it has been for them. And as we emerge, I think, from the restrictions, it is vital that we foster this culture of honesty around mental illness. But it's crucial that we recognise that not everyone will emerge with the same feeling of freedom. For some, the isolation of the past 18 months will have felt just like an extension of their normal life. And many will fear facing back into a world where they are excluded, where they are afraid to put up a hand for help and to admit struggling for fear of being judged once again. And it is a sad reality that many of those facing the toughest personal circumstances, those marginalised communities, such as travellers, LGBTQIA+, migrants, refugees and others, often feel forced to bury their suffering or to adopt a tough persona, to pretend that the discrimination doesn't sting, to pretend that the exclusion doesn't sting, and to be expected to just rise above it, so to speak. But of course, that's easier said than done, and it is vital that the necessary supports are provided in order to foster a culture of social inclusion wherein everyone, no matter what their background, feels no shame, no hesitation in asking for help for a mental illness, in the same way that we wouldn't feel shame seeking help for a physical illness. And that's why my department oversees a number of initiatives designed to maximise social inclusion and to encourage and support participation in activities that we know have a positive impact on mental health. There's a number of programs I oversee. I'll only focus on one of them. I have responsibility for SICAP, and this is the Social Inclusion and Community Activation Programme. And SICAP is the state's main social inclusion tool, and it's used by communities throughout Ireland to support groups through community development and individuals through one-to-one engagement with support workers. SICAP is an amazing national programme, and it plays a key role in every local area in tackling exclusion. And I would like just to give a couple of examples of some of the practical work that is being done under SICAP that assists mental health of people in particularly marginalised communities. So, for example, the Dublin Northwest Area Partnership have developed a suite of wellbeing and mindfulness workshops, health and wellness workshops, and a 6-week stress course to help people manage with that. A pilot programme was also developed for the Fingal Traveller Development Group aimed at improving mental health wellness through physical exercise. Paul Partnership in Limerick took a collaborative approach, including Doris Slimney and Limerick Mental Health Association, to support people living in direct provision in Limerick City and the environment with multiple needs, including challenges to their mental health. Waterford Women's Creative Cocoon Project, a social networking project, was established during COVID by Waterford Area Partnership to promote creativity, positive mental health and well-being during the pandemic. And Wexford Local Development Company engaged with people seeking international protection in emergency accommodation centres. And through initial face-to-face intervention by SICAP staff, strong relationships were developed and then underpinned by a web of interpersonal connections. And this in turn creates the conditions, I think, for personal development and good mental health. And then a final example, Lifelink Kilkenny is a mental health support group that has been supported by Kilkenny Leader Partnership through SICAP to undertake a study and put together a proposal for a crisis cafe in Kilkenny. And this vision is for a community peer-led response to those presenting with a mental health crisis during out of hours, and that will be open to all. And also because of other responsibilities I have as well, it would be remiss of me not to mention the issue of addiction, and has been touched upon as not just a health issue, but also a mental health issue. Addiction is an illness that we know causes even further exclusion and discrimination. And I think it may well be a challenge that we see more coming out of COVID. The Programme for Government commits to taking a health-led approach to addiction, and a number of projects under my remit help to tackle the issue of addiction in communities throughout Ireland. We do have specific community employment schemes with additional supports for people suffering from addiction, and SICAP projects also provide a varied array of initiatives throughout communities to engage with people to find a path through their addiction. The Programme for Government does recognise that promoting positive mental health and reducing the burden of mental illness can have benefits for everyone, and the National Policy on Mental Health, Sharing the Vision, a Mental Health Policy for Everyone, was published last year, and in conjunction with the implementation plan in Seònaid Care, sets out to deliver a number of important measures to change how we approach mental illness supports in Ireland. I'm not going to go through them all today, but it's important to mark it and mention it, I think. And really my and my own department's role in making that a reality is ultimately to decrease or remove the social exclusion currently experienced by far too many in our society, because I know and I understand that such exclusion can cause and without doubt does exacerbate mental illness. That's why the roadmap for social inclusion, which I have responsibility for, is key to ensuring that social inclusion is at the core of public policy and service delivery across all government departments, because it's only by fostering an inclusive and vibrant society within which everyone feels included and supported will we move to reality where it is okay to say that you're not okay. So to sum up, just to thank you again to Seechange for asking me to be involved in today's event. And thank you very much for your work over the years in helping to destigmatise mental illness. I do have a personal interest in it as well. I had a brother who suffered from a very severe mental illness, and a very large part of his suffering was the social stigma of that as well. So I'm a very much personal and ardent supporter of your work for many years, so it's a pleasure for me to be involved today. And I would like to recap that I do think we have an extraordinary opportunity to bring a dramatic change, I think, to how society perceives mental illness as we emerge from COVID. And I would encourage everyone to share their stories of mental illness and to reach out to those who they feel might be suffering, or who may just appreciate a check-in in the weeks and the months ahead. Thank you.
Thank you so much. And again, like I heard so many different messages, and I'm actually really glad that we have recorded this to listen back to it and really hear some of the messages that you talked about. But for me, it was, you talked about the fact that we are all struggling with anxiety now because of COVID, and the idea that life is changing and the pace that we're living at. But the fast mode, and what you were saying about I suppose reiterating that glorification for being busy. I think that's something that so many of us do, and it's so important that we start revisiting why we do that and the impact that it has. You talked about after the pressure eases, and I think that's a really important point, that so many people have been hanging on to get to the next place, but it's so important that we do give ourselves a chance to land and to work out, well, what happens. And this is the other thing as well. There's so many people who are so busy getting through it that they don't take the time to think about, well, what if? So today's point, I suppose, on that is to ask people to find out, if you don't know what the services are. You've also talked about community initiatives and different supports that are available. So for everybody who is on the call today, if you don't know what those supports are, if you don't know what's available in your area, if you don't know what's available nationally, if you don't know what's available online, please find out today, because it isn't the day when you are really struggling that you should be looking for that information. You should have it. And when somebody comes to you, you should have it. So finding out about, things like what Minister O'Brien has talked about, those different initiatives and how to get involved. It's really important that we do follow those things up and that we take those couple of minutes, because realistically, it is only 5 minutes, and the difference that it can make to all of us by having that information is absolutely massive. One of the things I really heard that you talked about was people from marginalised communities being forced to bury their suffering. That sentence alone carried such weight. And for me, I felt very emotional, actually, imagining that somebody is in a difficulty and that they're being forced to hide it because of who they are, because of where they're from, because of the experience that they're going through. Nobody should have to do that. And it's one of the things that I'm very grateful for the work we do in Seachange, that we help people share their stories and share their voices to remove that stigma. But I see that we have so much more work to do to be more inclusive in society. You also talked about multiple needs and including their mental health challenges, which I thought was interesting, because for so many people, all they see is mental health and they don't see the other challenges that are there. So again, it's trying to understand what additional barriers do people have? What kind of things are there that we need to understand? You know, are there literacy issues? Are there access issues? You know, are there societal issues that we need to address? I think there are so many different things that we haven't thought of and we haven't understood. So starting to work with your department and starting to work with various groups in this area is so important for all of us. And again, it's about, how do we find out more? How do we get more information on that? And particularly looking at those supports, you know, it's wonderful to hear that there are supports available, that there are initiatives being run. And I think that's one of the things, that when we're in crisis and when we're struggling, we focus on what's not being done. We focus on what isn't happening. And actually there is a lot that is still happening. There is a lot going on. I think it is something that we need to do more of, to have more conversations and be more inclusive. And certainly for me, today has already been educational, because I've learned something from you and I've learned something from Seána that I didn't know before. So I'm looking forward to that opportunity for dramatic change that you mentioned. That sounds phenomenal, and I am all on for that. And I think that's the thing, you know, when we talk about, Seána mentioned a ripple, and about the impact that we can have on others. When we think about this dramatic change, I think sometimes people feel like it's too far away, or it's too big, or, you know, somebody else has to do it. The government has to do it, somebody else. And I think this is the thing, and this is the power of every single one of us that's on this call. We all have the capacity to make a difference. We can all support change. And it is about that small difference that we can implement in our own lives. So it is about looking for the big dramatic changes. But the thing is, we have to take the baby steps. All the individual little things that we do, like wearing a green ribbon, like having these conversations, like going and connecting, you know, finding out after today, where do I need to go and get this information? Who else do I need to connect with? What else can I do? Those are the things that will start leaning us towards those dramatic changes. And I for one, feel very hopeful and very optimistic about that. And I think lastly, again, you mentioned the suffering to do with social stigma. And I think it is something that, when we think about somebody in difficulty, we think about, for me in the work that I do, it's all these layers. So we have difficulty of life in general, you know, things can be difficult sometimes. And then we add an illness, or we add a difficulty like mental health difficulty. And then we add a stigma because of that. And then from this perspective, we're going to add another layer, the social difficulties. And then there's another layer of social stigma on top of that. So it's just being compounded and compounded. And the word really that stood out to me is suffering. That's what we would really, really like to change. So I am just delighted that you could be part of our conversation today, and that you could really speak to those pieces. And we look forward to working more with you. And thank you for being with us today.
Thank you, Barbara. Thank you very much.
So now it is my absolute pleasure to introduce our next speaker. We have Seònaid, who is the founder of Amputee Disability Federation in Ireland. I had the pleasure of meeting Seònaid a number of years ago, and to say that I think she is phenomenal is putting it lightly. To talk of different things that we need to be aware of and challenges, I think she's going to speak very, very well to some of those different points. So, Seònaid, you are most welcome to join us today at the 9th Green Ribbon launch.
Thank you so much, Barbara, and it is such an absolute pleasure to be here. As you mentioned, I'm well known within the disability community, often for talking about my own disability, but more so for talking about inclusive practices when it comes to employment. But today, and I've been following this campaign for so long that it's a real pleasure for me today to kind of come out about my disability. And I don't mean my 2 prosthetic legs or my bionic arm. I mean talking about my mental health. When I started talking about disability, most of the time it was just to be able to survive, to be able to get my medical card and to retain any benefits that I actually had. But when it came to my mental health, that was in a totally different category. All of the issues that I needed for my physical disabilities were often taken care of, no problem. But the mental health side of things wasn't really included. However, I was so lucky. When the fire that started in my house when I was 18 in the middle of my leaving cert struck, I was so lucky that I had a full multidisciplinary team behind me. That included not just physiotherapists, occupational therapists, prosthetists, although I sometimes have to be careful with that word because if I say it quite fast, it sounds like something very different. So sometimes I just say limb fitters, might be a bit easier. All of those things were included within my rehabilitation plan. And my mental health was also being taken care of. But what I found fascinating when I tried to support other people who'd also gone through amputations was that most people didn't get that support. They had all the physical support they needed, the physiotherapists, all of that, but they didn't have any counselors. There were no psychiatrists, no psychologists, nobody that they could talk to about the fact that their bodies were now different. So when I want to come out about my disability, I don't just want to talk about my bionic limbs. I also want to talk about my mental health issues. And most people haven't let me over the years. It's almost like you can only have one disability allowed. You're not allowed to have any other disabilities. Well, you know, if I'm accommodating you in the workplace, I've sorted everything out for your prosthetics. I've sorted everything out for your limb fittings and whatever else you might need. But they never think about the other issues. When I started talking to other amputees, when we founded the Amputee Disability Federation of Ireland, it was simply to provide peer support to other people, to tell them what they were going to go through when they went for a leg fitting. But we began to realize that lopping off a leg was the least of their problems. Without having the support of mental health services along with the rehabilitation, really people were just not able to cope with what was happening to them. So throughout my experience, I've seen this situation where people are siloed and you can only really have one disability. So if you have a physical disability, God forbid you talk about all of the other things that are wrong with you. That was always the way it was expressed to me. Talk about your prosthetics. Talk about the fact that it's a bionic arm. You have great jokes about that. And most of them end with, and then my arm fell off. Boom, boom, boom. But I was never able or given the license to be able to talk about my mental health disabilities as well. As my friend said, God, no, don't tell them about something that's really wrong with you. And I really felt that I was being excluded from the party of mental health awareness and really the survivors of any mental health illness. I wasn't allowed to be part of that group because my wheelchair excluded me straight away. But the interesting thing is it was building on my mental health strength and building up that resilience that actually helped me get through everything else. It's very difficult to start to walk again. As I'm sure you can imagine, you don't remember the first time. But learning to walk on prosthetics was really psychologically challenging. And if it wasn't for all of the support that I had, not just from a home network perspective, but also in relation to professional services, I know I wouldn't be as well as I am today. So only having one disability just doesn't exist. I have never met someone with a physical disability who also hasn't had a mental health challenge. But that's the bit that they're told to stay quiet about. Because when it comes to requesting accommodations in the workplace or in education, most people don't want to have to think about the full gamut of what you're bringing to the workplace or to the school. They only want to deal with things that they can handle. And for many people, mental health just doesn't seem to come into that bracket. The interesting thing for me was the fire that happened in 1997 in the middle of my leaving cert. I just thought that after surviving that and after getting through that really tough time, I just thought it would be kind of easy from there on in. I'd forgotten that life likes to kick you in the face regular basis. And even when I'm changing my own shoes or my own socks and I kick myself in the face, it's kind of a little bit different. My husband says I have to be more careful because going around with a black eye doesn't make him look good. The interesting thing is, not only did I survive all of that, but I've had to survive so many other things like we all do. And just when I thought everything was sorted and I had gotten myself a new counsellor, COVID hit. And all of a sudden, the whole world became disabled overnight. We all started to learn what isolation is like. We all began to see what exclusion is like. And all of a sudden, you had a much better understanding as to what it's like for me when I'm refused access to a particular venue or a play or anything like that. For us, the hardest part was that we discovered a leak under our kitchen. So it meant that we had to move out. So I had gone from being in a situation where I had gotten my limbs, I had gotten a home, I had been happy in what I was doing, and the pandemic hit, and all of a sudden there I was without a medical card, legless again, homeless again, jobless again. It felt like I was back to square one, as if nothing had ever changed. And I was able to rely on the resilience that I had built up. And also, of course, knowing that I needed to put my hand up and say, I need help. I need help. And I went and I got a great counselor, and I was able to get through that really tough time. But what I found was so fascinating about it all was that acquiring of disability, that fighting through all those tough times, that just made me more resilient. I've been overdosing on Tokyo Paralympics and, of course, the Olympics, or as we call it in this house, the warm-up Olympics, because the Paralympics is where all the real heroes come out. I love watching them, particularly the Blade Runners, when my disability is the sexiest, when they're running down the track and you just think these people are amazing. But the one thing that the Paralympics and the Olympians all shared, might have been similar times, but they all talked about their mental health struggles and how overcoming those, surviving those made them stronger. Any mental health struggle that we encounter, and we all encounter them, it makes us more resilient. And instead of us being afraid to talk about it, instead of allowing people to tell us that we shouldn't be talking about it, we should be celebrating it. We should have disability pride when it comes to mental health, because we are the most resilient people. And if anything, if we've learned anything from coronavirus, it is that we are the most resilient group, and that we know what isolation and exclusion can feel like. And it's up to all of us to change it. One of the interesting things that I've discovered by experiencing this double discrimination or double stigma is that I'm not alone. When it comes to disability and mental health, we don't always sit in the same category. And as I said, if you have one disability, it precludes you from being allowed to experience any other disabilities. I was talking to a friend of mine in the deaf community, and she was explaining about a friend of hers who couldn't get a proper counsellor or a psychologist or anybody to talk to because it wouldn't be private. There are no psychologists or psychiatrists in Ireland, as far as I'm aware, who use Irish Sign Language or even International Sign Language. So how on earth could that individual actually get some help? So without even realizing it, we are excluding huge groups by their very nature, simply because we're not accepting that all of these beautiful different aspects of people can exist within one person. Disability can sometimes be described as us versus them, but we have to remember that disability is all of us. As my grandmother used to always say, if you're lucky enough to live long enough, you'll all acquire a disability, whether that's mental health or age-related sight loss, whatever it might be. It will touch us all at some stage. And the best thing about these Zoom conversations is it doesn't feel like I'm going to attack you all. As I've been told, it sounds a little bit threatening. You're all going to get disabilities. It's just my experience. When it comes to physical disabilities and other disabilities that you might acquire during your working life, 90% of us will acquire them during the ages of 18 and 65 during that working life. So why don't we do something about it? Why don't we change it? Why don't we reduce the stigma, be proud, and start the conversation? It's so important. I do my little bit, and I'm so pleased to be here and involved with you guys today. I'm also so happy to be on the board of directors of the Independent Living Movement of Ireland. Their vision is one where all disabled people have freedom, choice, and control over all aspects of their lives and can fully participate in an inclusive society as equals. So it's essential for all of us to group together, because we are all in this big struggle of life, and not to exclude anybody. So remember, disability doesn't discriminate. There's no shame in having mental health illness or a mental health ill history. What is important is to celebrate the fact that we're all survivors and we're all resilient. And I think that's the most important thing. So start the conversation, end the stigma, and love your disability.
Seònaid, you're absolutely amazing. Thank you so much for your honesty and your passion about helping people to understand what it's like to have a disability, and also your humor as well, because I think that's one of the misconceptions about disability, whether that's physical or mental health, that people aren't allowed to have a laugh, that they aren't allowed, also be human and have that. So it's wonderful for you to bring that and show people that you're a whole person.
And you know what's fascinating? There's so much research into what's known as the disability paradox. And I do believe that the same is true of mental health, where the idea that there's a perception that all disabled people have a poorer quality of life, that all people who've had mental health illnesses are really less well off than those that don't. But actually the opposite is true. We are just as happy. We are just as creative and wonderful as anyone who doesn't have a disability or mental ill health. In fact, I would argue we're far more creative and wonderful and innovative and resilient than any other group.
I'd agree with you, and certainly my experience is quite similar to that as well, and it's only because of my ill health history and my challenges with mental illness that I am the person that I am today, and that I found that resilience. And I think that's one of the things that really stood out to me from what you talked about. You talked about, well, first of all, you talked about the fact that you had both physical and mental health support, which is amazing, but you also highlighted that not everybody gets that. And, highlighting depending on what disability you have, that adds another layer of exclusion. And that's one of the things that we really need to become more aware of, what people do struggle with based on the logistics, because actually that's on us rather than on the person who has the disability. It's not their fault that we don't know how to provide that service, or that we aren't providing that service. So I think that was a really important point to make. I think the way that you described how people were siloed, and that, you're allowed to have this disability, but not this one, is again another really good point. And I think for a lot of people, when we're talking about mental illness, a lot of mental illnesses don't stand alone. So even before we add physical disability, a lot of people may have multiple different mental health challenges and different illnesses together. So that's one of the things, again, that it's like, well, if I'm in this camp over here, well, can I also be over there? And I think that's a really interesting conversation that we need to have, and help people understand that there's so many people, that there's crossover in so many different ways. So that's a really wonderful, wonderful thing to include in our conversation. You talked about being excluded from the party of survivors. I just thought that was a wonderful quote, I suppose, and a wonderful way to let people think that actually, inclusion is so very important, and particularly when we're finding things difficult because we're struggling with our mental health or our physical health, to add that feeling of being excluded, and then we turn it on ourselves, and that's the self-stigma, I'm not good enough and I'm being excluded because X, Y, and Z, and then I'm going to treat myself differently because obviously I deserve that. So it's all of those layers coming together, and I think that was really important to hear that, so thank you for sharing that. You also mentioned about accommodations in the workplace, and I think obviously for us, we have a workplace program, and we are so interested in having conversations about how do we have better conversations, how do we support people and become more equal in our workplaces. And I think that's the bit that we really need to see. And I know that you're doing a lot of work in that area as well. So we're happy to share links for you about some of the work you do to do with inclusion and accessibility and those different things in the workplace. But it is really important that workplaces understand that we need to have conversations with people instead of doing it for them, or doing it because we need to have a social inclusion policy. It's about actually making it real and having conversations and finding out how we can do it better to be more inclusive. When you talked about isolation and exclusion to do with COVID-19, I think you're right that there is an element where people did start suddenly feeling lonely. They did start struggling with this feeling, I don't know what way I feel, I'm not comfortable and I don't know why. And maybe it is because I haven't seen a real human being, or maybe it is because I'm not allowed out, or I'm not allowed you know, be a human and have that social contact. So to have that insight into what life might be like if we had a physical disability that prevented us, you know, like when we were talking a number of weeks ago, and you know, you joked about being legless, and I suddenly realized, you know, I have the use of both of my legs. I have the capacity to move myself wherever I want to be. And, you know, yes, I can't go and be social, but I can still go outside if I want to, or I can do those things. It just really struck me about sometimes how little we consider where other people are. And I think that was a really powerful thing to share, that again, it's an additional layer that we need to consider when we're talking to other people, what might be going on for them. The thing that I loved when you talked about the Olympians, that we all have, they talked about mental health struggles. And we're all human. We all have mental health, and that we all go through these things. But the thing that you really leaned into there as well is that we all become resilient because of the mental health struggles. And I think that was a really interesting thing, that we do become stronger because of what we've been through. And I think that quote of grow through what you go through, it's so important. And lastly, I love what you ended on. Why don't we change it? That really is kind of the thing that has driven me, because I know certainly back in 2009, a year after I survived suicide and I had been on life support, I got really angry that more wasn't being done. And I got angry that services weren't available. And I got angry that people were still dying because of stigma. Because quite often it's not because of their disability, it's not because of their illness, it's because they can't talk, it's because they can't connect. And I think that's the bit. And then I suddenly realized somebody should do something. And then I suddenly realized that I was somebody and that I should do something. And here I am now, so many years later, still bugging everybody with seechange, still talking about the green ribbon. But it is about individually, what can we do? So that piece of why don't we change it? If there's something that we're not doing, why are we not doing it? What's stopping us doing it? And how? And where do we go to find that information? So again, my reminder, like I was trying to remind when we were talking to Minister O'Brien about what can we do today? Where can we go and get information? So today is the day really that we ask people to find out, you know, following this conversation, to go and get those links, to follow up with my team, to go to our website and find out who were the speakers that we had today. Where do they work? You know, what else are they saying on this topic? What else can I find out from them? So we would be delighted to share about all of our speakers. So Seána, thank you so much for being with us. And your green ribbon.
To wear your green ribbon.
And wear your green ribbon. And I love that. I love that prompt. And actually I'll do a different, I was going to save it for later, but I'll do it now. So we have green ribbon masks.
Yes.
So if you haven't got a seechange green ribbon mask and you would like one, we would love to send them to you. So please email us. You can get us at info@seechange.ie. Send us your contact details and we will send them out to you. We have a couple of hundred left, so we can't do huge orders, but we would be delighted for you to have those masks to keep everybody safe, that we can continue having conversations and raise awareness around the whole conversation around being together and how we can be physically together, but what is it, socially together, but physically distant, isn't that it? So thank you so much for joining us, Seònaid. We're absolutely delighted to have you today.
Thanks for inviting me. It's been such a pleasure listening to everyone.
It's just been wonderful to have you. So, and on that note, it brings me great joy to move to our next speaker, Louise O'Brien. I've had the wonderful pleasure of working with Louise for a number of years now. I first met her when I was facilitating the seechange workplace program, and I'm delighted to now know her in so many different ways, as a seechange partner, as a seechange workplace, and I'm also very grateful to now call her my friend as well. So Louise, we're delighted to have you with us, and you're very welcome to the 9th Green Ribbon campaign.
Thank you very much, Barbara. And equally, I'm not quite sure that I can follow the lovely Seònaid there and the inspirational Seònaid. But if I give you a flavour, so I guess what you've asked us to talk about is exclusion and what that potentially might look like from a workplace perspective. And I know everybody has probably referenced that throughout. So I know you started off saying in terms of what exclusion can feel like, you know, for different people and for a variety of reasons. So whether that's part of being, of a minority group in society. So whether it's an ethnic minority, you know, you mentioned, or Seána mentioned at the start about the traveller community and the higher rates of suicide there, whether it's being a refugee, part of the LGBTQIA community, etc. So, or equally put on top of that, the mental health difficulty, whether that's from a short-term perspective or being diagnosed with a mental illness as such. So, and I know the last 18 months has really helped us all get a feel of that. So again, Seònaid has referenced that, but from an exclusion perspective, a lot of us obviously worked from home. Essential retail remained open, and from a Boots perspective, obviously our pharmacies were one of the essential services. But from a personal perspective, I suppose we had some of them restrictions imposed on us. So we couldn't meet friends for coffee. We were limited in where we could even go for a walk within a certain radius. And we had to physically distance ourselves from those we loved, I guess, to protect them. So many of us not actually getting to see our own loved ones for a protracted period of time. And then the additional stress of potentially maybe picking up COVID, etc. So for a lot of people, I suppose them circumstances will have left them feeling potentially lonely, isolated. And I suppose if people are experiencing exclusion, that can be often how their life feels on an ongoing basis. And overlay that then with the feelings that might include fear, shame, or embarrassment. So ultimately, I suppose a lot of people won't ask for help because of the shame and the stigma that they experience. And I suppose from the point of view, you know, whether that's a personal basis or even looking at it from a workplace perspective, a lot of us potentially will often prejudge or discriminate against others, and that can be for a variety of reasons. You know, it can be if somebody is different to us, they might have different values or different ethnicity, or potentially, like you've mentioned, they could have a mental health difficulty, and sometimes it can be all of them reasons. So I suppose from a company perspective, if we're looking at what we potentially have done, so from a diversity and inclusion perspective and an unconscious bias perspective, we have rolled out some training. So some of that is the unconscious bias training, and I guess whether we're aware of it or not, a lot of us can have that unconscious bias. For some of us, that might actually be, you know, unknowns to us, or we're not aware of it, and for some of us we might be aware of it, and sometimes that can even just show up in terms of our body language, never mind our thoughts. So some of the training that we've rolled out is making our colleagues and all of our teammates aware of that and bringing to the fore what them unconscious bias might look like. And I guess the real measure of that is always, you know, if we can answer that question in terms of how have I made that person feel, and whether that's a colleague or whether that's a customer. And I suppose ultimately that's what we've been trying to do around the unconscious bias perspective as well. And equally then from a diversity perspective, I suppose our aim as a company from a diversity and inclusion perspective is meaning that all of our colleagues feel welcome, valued and respected, enabling to bring themselves or their full selves to work, and that both colleagues and customers feel cared for. And absolutely, I would say this, you know, we're not fully there, but we are working on that and devising and implementing a strategy to help bring everything forward. But if we're taking a look from a mental health perspective, Barbara's referenced that we've worked with seechange since 2017, and we are very grateful for all the support that they have brought us along the way. And we're also one of 4 key distributors on the Green Ribbon campaign. So I see some of the other guys here as well. So obviously AIB, Rodaigh and Air Stores as well. So we're on 4 key distributors. So when you want that green ribbon, drop into any of us and we'll be able to help you over the coming months. But equally, if we're going back to the seechange workplace program, I guess there's been 6 steps involved in that, and that includes actually reviewing your mental health policy, engaging key stakeholders, providing mental health awareness training, line manager workshops, and promoting mental health internally on an ongoing basis before you're obviously signed off as an official partner. But I suppose if we're flipping it on its head and we're saying what can exclusion sometimes look like in the workplace, there can be a fear that sometimes if you share with another colleague or a manager that you have a mental health difficulty, that you think that they might treat you differently, or you might be excluded from certain tasks or meetings, or you're maybe not asked to take part in new projects, or that you might not be seen as suitable for promotion. And I suppose that's where it's key that leaders in the business are engaged and that they are open to discussing mental health and creating that environment to make it easier to have a conversation about it. So that's obviously one of the key things in terms of trying to eliminate that stigma within the workplace. So the 6-step program has absolutely helped with this. So with the leaders and line managers undertaking that half-day workshop, it gives them the framework and the tools to have those discussions. And I know from a line manager's perspective, you know, some of their fears in terms of going to that workshop might have been actually, oh, I'm deemed to be an expert once I've had that training. And that's absolutely allayed their fears from that perspective. It's about, I suppose, enabling them to have the framework and the support and tools to have that conversation. So, you know, from that point of view, it's known that they don't have to be an expert, but actually listening and being able to show the supports and know the supports that are available and direct people accordingly to them is key in having that conversation. And I guess from the programme and over the years of working with Seechange and equally promoting mental health on an ongoing internal basis, some of the insights might be being mindful of the language that we use in everyday life. And I guess if I'm putting my hand up, in the past, I have been guilty of this, but actually, you know, some of the language that we use describing a day. So we, you know, the reference about being busy earlier on, but actually sometimes it can be things like, oh, I've had a mental day, or I've had a crazy day, or a mad day. You know, so sometimes everyday language is what we need to observe and be mindful of. But equally using the tools that you have within the company. So whether it's your employee assistance program or any supporting documents and resources, so things like a wellbeing action plan, where, you know, that can help identify any potential triggers if somebody is going through mental health difficulty, and actually what supports are important to them. So that's a really useful tool, I suppose, in that respect as well. And equally, the employee assistance program and providers can help support with a range of different mechanisms or tools as well. So whether it's a webinar, equally we've utilised the Seechange ambassadors from to help provide webinars to our own colleagues internally as well. But I suppose one of the big things, if I'm reflecting back on it, and one of the ones that really had a huge impact, was a very short 2-minute video. And it really showed the power of both listening and opening up conversation. And we recorded a video potentially 12, 24 months ago through the eyes of a colleague, and it was a literally 2-minute video, and it showed the backdrop to potentially what might be going on in everybody's life outside of work. So it went through from, you know, potential issues that people might be facing from home, from a work perspective. And there was probably maybe about 30 different scenarios. But it ended then, I suppose, with actually how well do you know your colleague and what might be going on for them outside of work. And it really created some powerful and impactful conversations. So I suppose the other side of then is normalising mental health everyday context as to how people are feeling. And that can be whether, you know, we'll have daily huddles in our stores. So actually, how's everybody feeling? You're not feeling okay, or you are feeling okay, or what does that look like for you? Or equally building it into kind of a weekly comms perspective. So I suppose if we flip it around, we have like a well-being question that we put into our weekly comms. So everybody's back at school. We mentioned that this morning. I'm sure it's stressful for those people that have children at school going age, shooting them out the door. But actually, one of the things on that is from a learning perspective, and we're looking at the 5 ways to well-being. You know, learning and how we look to grow or develop is one of them things. So we'll put in a prompt question each week from a well-being point of view as well. And then equally, as a line manager, knowing the supports that you can put in place to help someone with mental health difficulties. So Barbara referenced it earlier, you know, if somebody comes and approaches you, then is not the time to go looking. So actually having all of that to hand from that point of view is really key. So, and even if it's something as simple as actually ringing your EAP provider to see what types of questions they ask, that you can allay that fear for somebody when they come to you. So some of them are really simple hints and tips, but actually they're the ones that, you know, have a practical or a pragmatic impact on a daily basis. And I suppose from the diversity, equity and inclusion strategy, again, we meet regularly with a wide range of colleagues throughout the business, and we've all of our roles represented and helping to shape that activity. But if we're looking from an inclusion perspective, we've had obviously recently World Day for Cultural Diversity. So we heard from senior leaders globally across the business about their own experiences growing up, and both positive and negative impacts. And they, I suppose, what was really heartening was they actually shared a lot of their vulnerabilities. And equally, you know, whether we're sharing our vulnerabilities, it makes us more open and creates that or fosters that really positive environment to be able to do that. So that was something that really worked well. And equally from the point of view of, on a local level, we had our colleagues from different ethnic backgrounds share some cultural information, a little bit about their country's traditions, recipes, favourite dishes, and from that point of view, from an inclusion perspective, actually they really valued being asked that, and obviously a lot of them haven't been home due to COVID, so it kind of really gave that positive feeling as well. And then I suppose we're looking from a customer perspective, and we're mentioning in terms of different minority groups. So one of the other things that we do also is we partner on the Stand Together campaign and making our stores dementia inclusive. So there are over 64,000 people living with dementia and over 500,000 people who've either cared for or caring for a family member living with dementia. And again, that's not an easy task. So we've rolled out training in that respect, dementia awareness training to all of our colleagues. And last year amidst COVID then, we also initiated the Safe Spaces campaign for anyone who was affected by domestic abuse and providing a private and safe area within our consultation room, enabling them to contact any one of the domestic abuse organisations across the country. But I suppose if I'm bringing it back then from that point of view, so some tips for workplaces, for other workplaces perhaps, around creating an inclusive environment. And again, I'm not saying that we're fully there, but we are trying to work as best we can to make that a diverse and inclusive environment across all of our stores. Is to education and training for staff and management is really key in terms of opening up that awareness. And starting to have open and honest conversations about mental health in the workplace. So one of the key aspects is including senior leaders and helping to create that open environment, because I guess the tone is set from the top. You know, if you see someone disclosing a mental health difficulty, then it very much, I suppose, gives you a bit of comfort in opening up around that as well. And avail of all of the support. So I absolutely can't highly recommend Seachange Workplace Programme enough. So utilise all of them resources. So from a call to action perspective, I guess, everybody has said it there in terms of wearing that green ribbon with pride, and start them conversations about mental health. Use the resources provided, and Seachange have obviously more in terms around reducing stigma at a local level. And you know what, we all have mental health. Sometimes it's good, sometimes it's not so good. So just a little reminder that there's absolutely no shame in having a mental health difficulty. And I had a higher stress level as well, pushing kids out to school this morning, but so absolutely no shame in that respect as well. But again, thank you, Barbara, for the opportunity of sharing just some of the work that we do in that space.
Thanks so much, Louise, and really for putting that personal piece on it, and even, you know, acknowledging that in the middle of your job and in the middle of the role, you're also mom, you know, and the idea that actually, you know, it's okay that we have additional stress. It's okay that we have a life. It's okay that these things happen, you know, and I think those are the kind of things when we're talking about how do we become more inclusive, it's about realizing that the person has other things going on. I know that you did share that the video through the eyes of a colleague with me before, and I thought it was such an impactful and powerful thing to do. And I think really if we can all take that idea of imagining what the other person is going through, or even not imagining it, but allowing the space for those possibilities, because that's kind of what we're talking about with all those additional layers, that we really never know what's going on, even when we know somebody very well. And even when we think we know what's going on, there's always space for other things or other scenarios. You know, you even mentioned about the dementia training and about the people who are caring for. So it may not be the person going through the scenario themselves, but they may be caring for somebody. So whether that's a physical illness, whether it's a mental illness, there are so many people. When we say affected by mental illness, it is about the grander conversation. It's about our families and friends being part of that. It's about the language that we use. And I again, nearly feel I should be offering you a job for Seachange. You know, it is those things that we talk about, the language of the everyday. This is how we take those baby steps, that we realize and say, well, actually, I need to change that. I need to think about, why did I say that? You know, and it is about going back to the points that were made earlier by both the Mayor of Fingal and by Minister Joe O'Brien about, you know, the busyness and about that piece of being so busy. So when we're saying I've had a mental day at work, there's a part of it that we're not considering the language we're using, and it's also nearly like this badge of honour of how busy we are. But I love that you highlighted that we do need to look at why we're using some of the language and the impact. And it's one of the things that one of our ambassadors, Abigail, speaks about on our podcast regularly, because she hosts it for us, and she talks about sometimes, you know, it's okay if we say the wrong thing, to say, actually, I'm going to take that back. I want to change that. You know, I'd like to use a different language instead. So it's okay to acknowledge that we've said something that maybe we shouldn't say, or that we'd like to say in a different way, or even sometimes to ask, because I think that's kind of come across so much. And when you were talking about your colleagues feeling valued and heard, particularly because they got to share about their culture, you know, it's that piece about asking people, well, what would make a difference to you? You know, and for somebody to feel valued and to feel heard, that's incredible. You know, I love that your the idea of, you know, how have I made a person feel, whether it's a staff member or whether it's a client, and that piece around, you know, that everybody should be feeling welcomed, respected, and valued. If we can consider that in any aspect of our lives, I think that is incredible. And for people who are struggling, really, that's a powerful thing to gift them back those things. Also, a great shout out. We haven't got to the distributors and where you can pick up your ribbon, so thank you for that shout. So if you missed it, I saw Emma put it in the chat that you can pick up your ribbons. So our distributors are Boots, Irish Rail, Air and AIB stores, and that's nationwide. So anywhere in the country you'll be able to get those, and with Irish Rail it is with the larger stations that you can get them. We still do have ribbons available, so if anybody is on the video call today and would like to order ribbons, we still have ribbons in the office. So again, if you would like to order those, you can drop us an email at info@seechange.ie and place that order. There's absolutely no problem with us getting those out. But to talk about, you know, you talked about leaders creating this open space and about the creating an environment and creating change in conversation. The thing that I really liked about that was you were talking about you don't have to be the expert. So while it's about getting the people on your team to have more open conversations, it's not putting the onus on them to fix. It's not making it that it is everything to do with them. And I think for everybody on the call today to take that piece away, that it's okay not to have all the answers. And it is about where do you go, again, this piece of signposting, where do you go to get the information? Do you have it? If you don't, who do you go to ask? So you mentioned about the EAP program, so that's Employee Assistance Program for anybody who doesn't know. So if you don't have access to an EAP program, maybe it's about finding out what other service providers there are or what other supports that you might be able to get. But I love the way that you were really saying about it, you don't have to be an expert. And that's certainly something that we have talked about for a very long time. And I remember one of the first sessions that I did as a facilitator of the workplace program, I learned to say that we have two of those, one of those, and that's on purpose, because we should listen twice as much as we speak. And I think that's one of the things that when we're having conversations about mental health and particularly mental illness, that we forget that it's okay not to have the answers. We forget that silence is okay. We forget that actually maybe the person just needs to be heard, and maybe they just need to say out whatever it is, that you don't have to have the answers. And sometimes sitting with the person and listening to what they have to say is the biggest gift that you can give them. And this idea of not having all the answers and not being an expert, it's okay to ask them, well, what do you need? What do you need right now? What would help you? Because that's empowering them. It's making them feel heard and valued, and it's giving you the space to not have to fix it and to not have to take it all on. So to know that Boots is doing all of that in different ways, but also, you know, I heard what you said about the continuous improvement that, you know, you've said kind of, we're not there yet, we've a lot to do, but from the work that we've seen and witnessed in the last 4 years, you've done so much in so many different areas to become more inclusive. And I think for me, looking at Sea Change and how we can guide people to go, it is about that education piece, and it is how do we have more inclusive conversations. So thank you so much for being part of the journey. Thank you for sharing your experience and the experience of Boots with us and with our colleagues today and everybody on the call. But also,
Barbara, there was just one final thing, I suppose, and on reflection that I haven't included is actually, in terms of stepping it on a level, it's probably challenging stereotypes. So actually, whilst that awareness is there and that unconscious bias, it's about probably bringing up a level and actually challenging when you do, you know, if you do hear something that's inappropriate, you know, and actually questioning that stereotype if we're looking at exclusion and inclusion. So that's probably one of the other things I probably omitted from that. But, you know, we would encourage people to do that as well, you know, to make it that inclusivity. And I think, you know, a couple of years back when we started in that mental health space, it was all about, you know, that listening thing, but actually it's about now challenging it a little bit further, and if something is inappropriate, in terms of actually calling that out. So
absolutely.
But yes, so
And it's a wonderful point, and it's one of the things that we do ask people to not just start a conversation, but to, you know, to help have better conversations. So it is about how do we have that language. And I suppose the caveat that I'll put on that is to have an appropriate conversation at an appropriate time in an appropriate way. So, you know, if it's something that somebody is very angry, or they're in quite heightened emotional state, that's not the time to be challenging, you know, the language that they're using. It might be that you revisit it at a different time. If it's a very busy area and there's other people there, it may be more appropriate to have the conversation one-on-one with that person. Or sometimes it's a small thing, like one of the easiest examples I can give is when I hear somebody say commit suicide. He committed suicide, she committed suicide. I will always call up, and how I address that is, I say, that's really interesting that you've used that particular sentence. Do you know that we don't say committed anymore? And the reason that we don't is because originally it was a sin against God and it was against the law. So essentially that's where it came from. But the stigma that it creates, and the additional layers, and we're talking about that shame and the embarrassment and the fear, it heaps all of that on, but it keeps it very separate. So then I'd say, you know, well, actually what we would say is that person died by suicide, or they took their life. The thing is that when we change that language, it does two things. First of all, it removes the shame for the person, or when we're talking about somebody that died by suicide particularly, quite often it's the families that are left behind that feel that shame. So we're making it easier for them to engage, but also what we're doing is we're bringing it closer, because when we say somebody committed suicide, it's kind of out there and it's separate. But when we're talking about somebody that died, that person is now with us, and we're talking about a human being. And that's really what we're talking about today, about being inclusive. We're talking about people's stories, we're talking about people's lives, we're talking about how we can bring people closer together and be of support and be of help and have those conversations. So you're absolutely right. It isn't just about wearing a green ribbon and saying I'm open to have a conversation. It is about actively challenging stigma. So if you want to find out more about how to do that in a safe and appropriate way, please do contact us. Again, that's info@seechange.ie, and you can go to our website, that's seechange.ie, to find out more about that. So thank you so much. And to find out more about what Boots does with us, we have a number of different things over the last number of years in the like of our Green Ribbon report as well, if you want to find out a little bit more and follow up on some of the things that Louise has talked about, because she has always supported us in talking about those things before. So thank you so much for joining us and being part of our launch today.
Thanks, Barbara.
Thank you. So now it is my absolute pleasure to bring you one of our wonderful ambassadors, and this is a new ambassador for us this year. So for those of you who don't know, an ambassador of Seachange is somebody with lived experience of mental ill health who is working with us to challenge stigma and change the conversation around mental health. So Michael Verrecchia is with us today, but he is joining us as drag queen performer Carrie Deway. You're so very welcome to join us, and thank you for being with us for the 9th launch of our Green Ribbon campaign.
Thank you very much, Barbara, for having me today. As you can see, I'm not Michael today. I am actually wearing, as someone mentioned earlier on, we wear masks. Carrie is my armor. She is my mask, and she is my inner diva that I get to wear proudly and present who I am, and she can hide a lot of things. So I want to say thank you for having me here today to speak. I just want to kick off with a few different words like inclusion, acceptance, self-worth, safety, warmth, love, compassion, understanding, and empathy. They're just a few words that come to my mind when I feel included. Exclusion, unwanted, weird, unsafe, hypocrisy, uncomfortable. Some words that might come to mind when I feel excluded. Faggot, homo, fairy, freak, predator, nut job, basket case, unstable, worthless, and oversensitive. Those are just some words that have been used against me in my life for my sexuality and now for my mental illness. As a proud and out member of the LGBTQIA+ community, when I left one closet, I entered another one because of my own self-stigma and the stigma that's been created by society for feeling afraid to speak out about who you truly are and how you truly feel. In order to help you understand my journey and my story and how I got here today, I'm going to need to take you back 32 years. 1989, the year where most of these troubles started for my family. I want you to picture this: 4 young children, 7 months old, 4 years of age, and 8 years of age. A mother and father in this kitchen. There's a knock on the front door. Father had just finished the milk run for the Christmas. Mother opens the front door and is grabbed by her ponytail and dragged into the living room and thrown in front of her 3 children. A shotgun is then held in front of these 3 children's faces. Remember, they're 7 months old, 4 years old, and 8 years old. Some psychologists have done studies that have shown that a traumatic event from the ages of 2 to 4 can stick with a child for the rest of their life. Those men left that night with what they came for. But what they left behind was trauma that a family had to live with for the rest of their lives. Let's fast forward 17 years. That same 7-month-old baby is now coming to terms with their sexuality and who they are, but living in an area that's heavily dominated by unconscious bias or toxic masculinity. And in a Christian Brothers school, this young 17-year-old is afraid to speak out. Because what they've learned in those 17 years is it's not right to love another person of the same gender. It's not right to be different and stand out. And more importantly, unfortunately, in our beautiful little country, we've been told to bottle things up. Someone asks you if you're okay, you just say you're grand. No one wants to hear about it, but that's not the truth. There are plenty of people out there who want to hear about it. And that young 17-year-old in that same year, they're coming to terms with who they are and what they are because of that self-stigma, attempted suicide. That same 4-year-old child, my older brother, was there for me to pull me back from that darkness because I didn't feel I could reach out to help anywhere else. But that same 4-year-old who grew up to be my big brother was there for me and helped me through the dark times. Fast forward to 2014. That same 17-year-old is now 25 years of age, living in the UK, working away from the family. Close to midnight, receives a phone call. There'd been a fire in the family home. It wasn't an accident. That same 4-year-old boy in 1989 took his own life and left behind the trauma with the rest of the family. That same 8-year-old boy who's now older, that 24-year-old boy who's now fully accepted with who they are, relapses and makes another attempt on their life. But again, that big brother, he may not be there physically, but he was there emotionally and mentally to bring that person back out. And if it wasn't for drag, I don't know if I'd be here today. If it wasn't for knowing that my guardian angel, my brother, who died from suicide, and as Barbara mentioned earlier on, when we hear people say committed suicide, we know that's not right. Just like we know we shouldn't call someone a tranny or a faggot. We know that's not right. We know we shouldn't use slurs. So just like calling someone a tranny or calling someone a faggot, saying someone died but committed suicide can also have the same effect on that family as those other horrible words. So let's fast forward to last year. COVID-19. Everything's happening. The world's falling under. People are feeling like they can't speak, feeling more and more and more trapped, feeling more and more pushed inside that closet because now we're actually home alone. And those dark thoughts creep back in. And you remember a time when there was no pain, but that's seeming like a distant memory now. But then you look to the new generation coming up. Children not afraid to be who they are. Children not afraid to speak out openly. I did an event last week in Wexford for Wexford Pride in Redmond Park. And there was a young child named Teddy who came up, 13 years of age, and read us a poem that they wrote themselves. And the poem was entitled, I Am Who I Am. And the words that this child spoke, 13 years of age, we could all learn something from them. They truly had accepted themselves, and they truly had accepted others around them, and weren't afraid to talk about anything. Everything was an open conversation, right down to mental health. So if there's anything we can learn from over the years, is bottling things up doesn't help. Locking yourself away doesn't help. You may think it helps in that moment, but speaking from my own experience, when I locked myself away, the light was fading and it was getting darker. When I reached out for help, even if it was just a conversation with a stranger, that light would brighten and that closet door would open back up. So let's keep our clothes in the closet and not ourselves. It's bad enough we box people up into these different categories. Why should we box ourselves up with our own self-stigma? You are who you are. Your scars are your scars. Your past is your past. And without that past, you wouldn't be the person you are today. So just remember, no matter how dark the times get, they do get brighter. And I know we hear that a lot nowadays, and people are probably thinking to themselves, oh, here we go. Here's another drag queen trying to tell us, so I'll be positive. But no, it's true. They do get brighter. And the more open we are to have conversations, the better things will get. As you can see, I have the pronouns he, she, they. I use all of them. Because when I'm in drag, I am an entity. And whatever you'd like to call me, as long as it makes you happy, I'm happy too. But just remember, we need to open the conversation. I know I keep saying it, but it's very important that we open this conversation and remove stigma surrounding mental health, especially. Because as Barbara said earlier on, we all have mental health. We do. I suffer from anxiety, social anxiety. Yep, you're looking at me thinking, how could you suffer from social anxiety? But I'm what they call an introverted extrovert. So without this beautiful clown I'm wearing today, the real Michael might have been terrified, shaking in a corner, riddled with social anxiety that he has to speak out in front of everyone. But then I remember the power she gave me, this inner diva. She kept me here. She made me realize that my story needs to be shared. Maybe just for one person, even if it just reaches one person so they know you don't have to bottle up how you feel. You don't have to bottle up who you are. Just be yourself and be proud of that and help reduce the stigma. I joined seechange so I could help spread my story. And yes, I've battled with a few different thoughts over the last few months with, is being a mental health ambassador helping my mental health, or is it a detriment to my health? No, it's not. Because I'm facing these problems head on. I'm looking at them and I'm realizing you're not scary at all. You've come from my brain. And you've come from social media and living our lives through other people. But we just have to take a step back, look in the mirror, not the camera, because the mirror is going to show you who's really there. A camera and social media will only let the world see what you want to see. So in order to live these perfect Instagram lives and these perfect Facebook stories, we need to look inwards first and share with each other and just know that everyone's there for one another. My name's Carrie Deway. I suffer from anxiety, depression, and I'm a suicide survivor, and I'm more than okay with that.
You're absolutely stunning, and thank you so much. And I don't know if you can see some of the other videos and people coming in on the chat, but there is so much love for you and for the story that you have just shared. And to let people on the call know, this is the first time that Carrie is sharing her story with us today in this way. Incredibly powerful, as I knew that you would. And I think there's so many things that you've spoken of. I know that I won't capture it in any way the way that I would like to, but I'm going to do my best anyway. When you shared the words at the beginning, that was really, really powerful. And things like the word safety and unsafe, we shouldn't have to consider that. We shouldn't have to think that that's even an issue. So to even consider that that is there, again, it's that additional layer. You talked about compassion and understanding. I think that's something that everybody wants. But you also used the words like unwanted, you know, and I think that nobody wants to feel like that. And I think if we can imagine anybody feeling unwanted, I would like to hope that we would like to go to them and make them feel more included and bring them in and ask them, what would you need to feel wanted right now? What would you need to help you have that conversation? So thank you for starting off so powerfully in that. You also used words like nut job and basket case and oversensitive. And I think for some people listening, that might have been a challenge, it might have been difficult, but that's where we are in the reality that we have, that people still do use some of those stigmatizing words and that language. And it's like Louise said earlier on, that we need to be mindful of the words that we say and why we say them. And I know that there are some people that, you know, are maybe using them because they're choosing that. And it's about how we respond in that case. But sometimes people use words that they're not really considering. So thank you for drawing attention to that again. You talked about self-stigma and that people are afraid to speak and afraid to show how they feel. And I think regardless of your sexuality or your background or where you're living or where you are in social standing, we shouldn't be afraid to be who we are. We should feel okay to feel whatever we're feeling at any different time. It's something that I am very, very grateful in the job that I have a team of amazing people that we can be ourselves, you know, and I've worked with so many organizations and this idea of bring yourself to work. A lot of people can't. And it's something that we are working together towards, but that is a really powerful message to tell people that they shouldn't be afraid to feel how they feel. I really heard you when you said it's not right to be told that it's not right to be different or to stand out. You know, we should all shine, and anybody that knows me will know that sparkles is my thing. And, you know, it's funny, I work for an organization called Shine. So for me, that idea that we should all shine, we should all stand up and be heard and be counted and be who we are and feel how we feel. And sometimes that's challenging. And like we were talking with Seònaid earlier about how sometimes she's not feeling great, but she can still have a laugh. You know, it's about having challenging emotions and working our way through them. When you said that you didn't feel that you could reach out anywhere else, that really spoke to some of the things that we talked about earlier here, how people don't feel that they can connect. And I'm very grateful to your big brother that he was there for you and that you are still here. And I know that we've spoken about this before, and hearing your story again, I am so sorry for your loss and what you went through. But seeing how resilient you are because of that is really an incredible story, I suppose, to show the love that he had for you and that you had for him. And I think that's the bit that we're talking about, this piece of resilience. That's, you know, we grow through what we go through. And I think that really is it. Thank you for speaking so openly about suicide. We've been talking about uncomfortable conversations in our pre-campaign across August, and we did have a conversation with the National Office of Suicide Prevention about having those conversations. But hearing how you spoke about it, it normalizes it so much, but it also makes it more real. And I think that's how we have better conversations, when we allow people to have that conversation and say what we feel. But you did it in such a responsible way, and you did it in such a respectful way, but in such a way that your brother isn't forgotten. It's not that we should be shaming you or your family for what happened to him and the experience that you've all been through. So thank you for sharing that part of your conversation. You talked a lot about the conversation that would brighten the darkness. And I loved what you said when you said you're not scary at all. Because you know what? I think no matter who we are, at some point or another, we have all judged ourselves. We have all felt that piece of stigma. We have all felt that thing that I am not good enough. We have felt that piece of, you know, maybe I should be a little bit smaller. Maybe I should be a little bit less bright. Maybe I should be X, Y, or Z. And I think that message, you know, that you are who you are and that, you know, you deserve to shine, I think that is so beautiful. And the messaging that you've given us is so very powerful. And really, to say that a conversation will brighten the darkness, that to me should be our new tagline, because it's so powerful. So thank you so very much for joining us today and for sharing your story and for sharing your sparkles. I'm just loving that background.
Just for you, Barbara, that was.
I'm feeling very plain, I have to say. I'm going to have to step it up for next year.
I'll post you over something.
Well, if you've got green sparkles, I think that would be very fitting for green ribbon and seechange. So thank you so much, and it's just been such a pleasure to have you with us and share your story. And if you want to find out more about our ambassadors, because we have so many different ambassadors with us, our ambassadors have also all received training on how to share their story appropriately, on how to do good self-care, and all of those different pieces. So if you want to find out more about our ambassadors or hear their stories, you can find out about that on our website. We have also interviewed a lot of our ambassadors this year on our podcast, and they're all available to listen back to. And each month we have a different theme, so our ambassadors have linked in on those themes. And Carrie Deway did do one of those podcasts. So if you want to listen to it, you can go to our website. It's also available on Spotify as well. So at this point, I just would like to remind everybody that if you haven't got your ribbons, it's upside down. If you haven't got your ribbon, and if you haven't got your mask, the mask you can contact us directly for packs of ribbons. They come in a pack of 100. We would be delighted to send them out. If you are looking for individual ribbons, again, our distributors around the country are Boots, AIB, Air and Irish Rail. So you'll be able to pick up some ribbons from any of those places. Otherwise, as I say, you can contact us, and that's info@seechange.ie. The other thing that I'd like to bring your attention to as well, we do have a number of resources on our website. So if you're planning doing something for Green Ribbon and you'd like to have our posters, or you'd like to put bunting up around work, or you'd like to have the email signature with the green ribbon, or any of those things, they are all available on our website, that's seechange.ie, and there is a green ribbon section there where you can download everything. We also have a What is Stigma guide. So this talks about the language of stigma. It talks about really what we've been talking about today. What does stigma mean, and where does it show up in society, and some of the things that we can do around that. We've also heard today an awful lot about anxiety. We've talked about COVID, we've talked about returning to the workplace, we've talked about having different conversations. So one of the other supports and guides that we have is COVID-19, a new reality, returning to the workplace. This booklet was written in conjunction with Mental Health Ireland, and we're looking at sharing information to help people understand how to have a different conversation. But it's okay to say, do you know what, I feel uncomfortable because I've been down in the supermarket and somebody was standing too close to me. I feel very anxious about that. Or I feel anxious about going back to work and I don't know if somebody has done the cleaning and I need to do more, or I'm just feeling slightly funny and I don't know why. I can't put my finger on what's going on. So we want to share some of those things with you to help you to have different conversations, and particularly looking at the kind of language that we use. So in both of those guides, they will raise the awareness of the language that we've mentioned today, and things like saying, I've had a crazy day at work, or it's crazy busy down in the shop, or I've had a mad day, or things are mental. We would ask people to really consider why we are using that language, and particularly if we are using it, to say, well, what's behind that? Is there something else I could say that would still be as descriptive? Because the thing is that actually, for you, changing that word probably won't make any difference at all. You probably won't notice it, and it'll become a habit that you stop using it. But for the person who is hearing it and feels negatively impacted, it is going to do lots of different things for them. So first of all, it's going to close down the conversation. So most likely, if they felt that they could talk to you about mental health difficulties, if they're hearing you use that kind of language, maybe they're going to take a step back. Or if they hadn't spoken to you about their mental health difficulties, maybe hearing how you speak or how responsible you are with your language might be the thing that opens that door. Louise talked earlier about leading the way, about showing the way and how to be a leader. So it's not about, well, I'm not a manager, so I can't do that. We can all be leaders in our own lives. So it is about, how do I become more open? For me, with my team, it is about showing up, and on a day when I'm not doing great, I'll say, do you know what, I'm not doing great. It isn't that you have to get into all of the details, but it's about not hiding. And one of the things that Carrie said when she came on first was about wearing a mask. We all do that, and the weight of that mask can be too much for so many people. So it's about showing up and allowing people to have that space. It's not about saying you have to give all the information and share all of the gory details, but to be able to say, do you know, I'm not great today. That's all I need to say. Or, do you know what, I'm not great, but you know, I don't need your support today, but I'll manage it. It is about taken responsibility for our own conversations. And in doing that, what we're also doing is we're opening the door to say, I'm okay with my mental health, which means I'm okay for you to have a conversation about your mental health. And that is an incredible gift, because often when people come to us to have that conversation for the first time, they don't know what to say. They don't know how to say it. They don't know how to start. And most often it isn't about sitting down and saying, well, how's your mental health? Because that would just be weird. And if somebody said it, I think we'd probably all back away. Usually how it happens is, do you want a cup of tea? Do you know? Come on and we'll have a cuppa, and we start talking about what was on TV. We start talking about the football. We start talking about the weather. We probably talk about COVID. But so many other things that we talk about. And then we start talking about, well, do you know what? Oh, I was struggling a bit with this at work, or I was struggling with this, you know, I was feeling anxious down in the supermarket. And we start getting into the nitty gritty of the things that we're worrying about. Or maybe, do you know what? I didn't sleep great last night. I'm feeling a bit ratty today. That's the door. That's how we get into those conversations. And going back to what we talked about earlier, what does that look like for you? What do you need right now? Those are the ways that we have different conversations. So all of that is to bring us to a place where each of us can make a difference. So from a point of view of Sea Change, we are delighted to have all of you with us to launch our 9th Green Ribbon campaign. I obviously am very disappointed that we're not together in person, because it would have been wonderful to do that. Mind you, I'm just seeing that Carrie has just changed a filter. Emma, can you please spotlight her, because she's just completely turned green, which leads me to light up greens. If we have any organisations who would like to light up green for Green Ribbon, you know, this is a very new way of lighting up green. I've never seen this. Light up green is usually for buildings, but that was pretty impressive. Oh, look at that, Sea Change. There you go. Absolutely fabulous. This is a first on our launches. I'm so impressed. And I have to say, I feel like I've let the site down. I don't even have one of those props. So well done. So if I can remind everybody the links, you're going to email us at info@seechange.ie. You're going to visit seechange.ie for downloading the Green Ribbon, or for visiting our podcast, or for finding out about our ambassadors. You can also find out about our workplace program there as well. And my wonderful team are putting all that information in the chat for us. So I would like to say a massive thank you so much to our speakers today. We had Seána Rodaigh, we had Minister O'Brien, Seònaid, Louise O'Brien, and Carrie Deway. Thank you so much, all of you, for being part of this important conversation and for helping us include more voices, because today really is about kicking off the change. We want to move away from exclusion and become more inclusive. So I'm going to stop talking now, and I'm going to invite everybody who is attending. If you have any questions, now is your chance. So if you would like to either unmute yourself and you can turn your video on so you can ask directly. You also have the opportunity in the chat, if you'd like to put a message, when you're typing the message just above that, you can put in to everyone so everybody will see. Otherwise, you can select to Sea Change or to Emma Halvey. And they are the two Emmas on my team, and they will direct the message to me, and I will be able to ask the question anonymously at that point. So if you do have any questions, I would love to put them to our remaining panel members.
Hello, Barbara.
Is that Patrick?
It is, yeah.
How are you doing, my friend?
Not bad, not bad. You forgot to mention the green bales.
The green bales. So for everybody, if you can't see Patrick, Patrick is one of our wonderful ambassadors down in Wexford, and he is a farmer, and every year for the last number of years he has been wrapping his bales in green to get more people talking about mental health. He is a massive advocate in that area and does great work. He also had a launch recently. Do you want to tell us where you were on the 31st? That was yesterday?
It was Sunday, the Friday night. I was in Johnstown Castle.
There you go. So I even got the date wrong. So Johnstown Castle.
Castle,
yeah.
County Wexford, yeah.
Fair play to you.
We had a great day in it.
You did.
Yeah.
You did. So everybody
Yeah.
will be able to see those photographs on our Facebook page, and we will probably include them in our Green Ribbon report as well. So at the end of the month, we will be including voices from all over the country. So if you are running an event, if you are participating in anything, whatever you're doing, send us the photographs, put it up on Facebook, on Instagram and on Twitter, and do tag us. So the hashtags that you're going to use this year are Green Ribbon IRL and End the Stigma, and also seechange. And it's seechange IRL, I think, actually, if I'm correct. So anything that you're going to do, please let us know. We would love to include it. And Patrick has been wonderful at leading the way and getting so many people involved in different conversations. And it's one of the things, I went down to Wexford the end of 2019, and we had a wonderful conversation with his entire community. And that's it. One person can make a difference. So I don't see any questions in the chat there. So has anybody got questions for me, or have we answered all the questions that you possibly have? This is the awkward moment where I'm standing looking at the screen, where if we were in person, you might have a hand, or you might catch an eye with somebody, but seeing as I can't see all of you in person, I can't pick on anybody quite the same. So
I'll even, not so much of a question, Barbara, it's Teresa here in AIB. How are you?
Hiya, Teresa.
More so of a comment on, you know, just to say a massive well done on yet another amazing launch. I have to say I had to turn off my camera once or twice. The tears were just, they wouldn't stop today. I thought, you know, we'd talk about powerful, and it was absolutely phenomenal. And I'm really, really proud to be part of, I suppose, the overall AIB, you know, the official distributor of the Green Ribbon. It's, as you know, we've been doing it now for the last 3 years, and I'm extremely proud of it. Proud to kind of have sat here and listen to the launch today. It's absolutely fantastic, and well done to everyone involved.
Thank you so
that
much.
was it, more of a comment than a question, but
no, that's great, and it's wonderful to have you with us. And again, people can pick up your ribbons in any of the AIB stores around the country. And for people to know as well that AIB have also gone through our workplace program, and also have I nearly said instigated, but created a wellness program for your own colleagues. So there's a lot of the kind of things that Boots would have done that AIB have also done. So it is about leading the way and having those conversations. So thanks for being with us again for another Green Ribbon campaign.
Thanks for having us.
Thanks so much, Teresa. So I still don't see any questions in our chat there. So I'm just going to check in with my team and see if any of the private posts have come in on Teams. So this is where multitasking is great, that we've got Teams and Zoom open at the same time, just in case there's any technical issues. So it doesn't look like we have any questions. So so what I'm going to do then is, if there are no questions, I'm going to invite people to spend a couple of minutes after coming offline. Well, first of all, give yourself a physical shake, because you know you've probably been sitting for quite a period of time now. I've been standing because I find it a little bit easier, but you know, give yourself a chance to move. The second thing I'm going to ask you to do is to look at the different things that we have talked about today. So I'm asking you to go to the Seachange website. I'm asking you to follow us on Instagram, on Facebook and on Twitter. I nearly got that wrong. And it's Seachange IRL that you're looking for. And you can also find us on the hashtag Green Ribbon IRL. We would love for you to get engaged and get involved. So if you are running an event or participating in anything, please do send us an email, or send us your photographs. You can also tag us on the social media. And in the chat there, all of the information is available for the different links that I had mentioned. And we will also put up a post later on today on social media and also on our website with all of the things that we spoke about to do with supports and signposting and those kind of things. So again, lastly, if you haven't got your ribbons, now is the time to order. So again, just to remind you, your ribbon, if you're getting an individual ribbon, it's at Boots, AIB, Air and Irish Rail. If you're going to get masks, you're going to come to us directly and we can send you some of those. If you would like to get a larger order, so that's 100 or more, you can contact us. So again, for masks or the larger orders, that's going to be info@seechange.ie. So just to say thank you so much. It has been my absolute privilege to launch this year's campaign. My first campaign, I would have helped to launch as an ambassador and tell my story, and to now be guiding this program and sharing so many voices and bringing the voices of people like Carrie is my absolute honor and privilege. And I really appreciate all of you for supporting us. I'd also like to say thank you massively to my team. So that's Seána, Emma, and Rachel. And I really couldn't do my job without them. I'd also like to say thank you to Shine, to my colleagues there, and also to my manager, Caroline, because she has supported me massively in this. We would also like to flag that the Lord Mayor of Dublin would have liked to have been available. So our thanks to her and for attending our Green Ribbon photo call. There are so many people behind what we do, and I know I can't say thank you to everybody. So just know that we know everything that you've done, and we know everything that you are continuing to do. Lastly, I'd like to invite you to come to some of our different events. So if you aren't aware, you can find out about our events both on our website and across our social media. So those events are going to be the 3rd of September. We have our Cork launch from 11 till 1. Next week, then we have a social inclusion event on the 9th of September from 3 to 4 p.m. Week 3, we have an event on feeling. That's Wednesday the 15th, and that's going to be 2 to 3 p.m. And then the week of the 4th week is the week of behaviour, and that is going to be Tuesday the 21st, 5 to 6 p.m. So all of those will be Eventbrite. All of the information will be there. And as I say, we'll be sharing it on social media. We also will have an event the last week in September, but we are finalising speakers for that at the moment. We're trying to get the president, and I probably shouldn't say that, but you know, that's why we haven't delivered the details on that one yet. No pressure, Rachel. So thank you all so very much. We are delighted to officially launch Green Ribbon Campaign, and we look forward to having you with us.